There are 3 levels in the course. Today we're going to take a look at some exercises from level 2. As you can see, lessons in level 2 are on the left-hand side. Everything is in the medical context. We'll take a look at something from pharmacy and medicines. Self-directed exercises guide students to learn both medical Spanish and also cultural competency.
Hola. Good to see you again. This session will focus on medication and we'll start by learning vocabulary for different types of drugs. Next, you'll learn how to use the present perfect tense to discuss events that have happened in the past. Then we'll revisit medication and go over words you'll need to give proper dosage instructions and warnings about side effects.
Now that we know what we're about to learn, we can move on to the next exercise. Here is a patient-provider dialogue, which you can click and listen to. You can also see the Spanish and the English.
Hola, señorita Torres. ¿Cómo está hoy?
Más o menos. Estoy un poco confundida con todas mis medicinas.
¿En qué puedo ayudarle?
After listening to the conversation, you can do an exercise which asks you to complete the sentence, and these are phrases that were in the conversation that you just listened to. You can check your answer. If you get the wrong answer and you cannot figure it out, you can look at the correct answer and correct your answer.
La inyección es para la insulina debido a su diabetes.
Another example of an exercise is the flashcard section, which shows you vocabulary words that you just learned from the patient-provider dialogue.
El gotero. El inhalador. El jarabe.
Now that you've learned some new vocabulary words, you can move on to the exercise, which again helps you reinforce those vocabulary words by asking you to match the English to the Spanish. Another exercise that you can do is a role play exercise, where you can listen to how something is supposed to be said by a provider.
Hola, señorita Torres. ¿Cómo está hoy?
And then you can record yourself saying that phrase into the program and compare how something is supposed to be said versus how you are saying it. Hola, señorita Torres. ¿Cómo está hoy?
Hola, señorita Torres. ¿Cómo está hoy?
Hola, señorita Torres. ¿Cómo está hoy? In addition to learning medical Spanish, you can also learn about areas of cultural competency.
We commonly exchange the words medicine and drug in English. We routinely refer to drug trials, drug companies, and drug interactions when we discuss medicines. Although they are interchangeable terms in English, they have very separate meanings in Spanish. Las medicinas are purchased in a farmacia from a farmacéutico and can be over the counter or recetadas, while las drogas are purchased from a traficante de drogas and are illegal.
Now moving on to a section of the course called telenovela. In the telenovela, there's a drama series that students can watch, and I will play an example clip from the series. I will fast forward a little bit to get to a part with a conversation.
¿Algún medicamento o un antibiótico?
Hubo un tiempo en que la sulfa me causaba una cierta reacción, como un salpullido, pero ya no.
¿Y toma algún tipo de analgésico o tranquilizante?
Yo creo que por eso siempre estoy somnolienta.
Doctor Cooper, ¿no tiene nada que preguntarle a la paciente?
Yolanda, hay ciertas políticas en casos como el suyo. Por ley, estamos obligados a hacer lo posible por mitigar su dolor. Sin embargo,
These episodes in the telenovela put learning into context. All of the vocabulary and the grammar and the cultural competency that was presented in the lesson is now shown in the telenovela to help the student understand how to use what they just learned in context. After you watch the telenovela episode, you do exercises based on it. You get a student dossier with the patient dossier with a patient's treatment and diagnosis, and you answer true-false questions based on the episode that you just watched to help you with listening comprehension, exercises to match what you saw in the video in Spanish and to answer questions about the content that you saw. After you're done with the exercises, you can take a quiz, which will give you instant feedback and also help you remediate. The quiz tests for vocabulary, listening comprehension, cultural competency, grammar. After submitting the quiz, you'll not only get an overall grade, you'll also get grades by section. In areas where the student performs poorly, they're pointed back to the exercises that can help them remediate. That was just a small sample of one lesson within Level 2 of the Medical Spanish course. Within Canopy, there are 3 total levels, each with 12 lessons. What you saw there was Level 2. Example of lessons in Level 1 include at the clinic, physical exam, vaccines and allergies, screening for cancer, depression and anxiety. And then Level 3 include lessons on trauma, discharge planning, well baby visit, seizures, depression, and suicide. For more information about Canopy, visit us at canopyapps.com. Thank you.